Hi, I'm Dr. Damien Gatinel from Paris, France. I work in the Rothschild Foundation Hospital in Paris. I'm the head of the anterior segment and refractive surgery department. I work clinically, and I'm also doing some research in the field of refractive surgery, IOL, optics, etc. I'm also occasionally a member of some advisory board, and that includes KERANOVA. "33 cataract cases, average grade 2.6, were done at Dr. Pavel Stodulka Center in the Czech Republic. Interestingly, the contralateral eye was used as control and then underwent a conventional photoemulsification on the same day. Therefore, the appreciation of the benefit brought by the femtometric machine was easy to measure, I think, in a very objective way. Yes, so the robotic arm seemed very helpful in facilitating the docking and then the undocking of the patient, which is always a sensitive part with conventional laser system. I think the fact of not having to change rooms and move the patient is a major advantage, I think, both in terms of safety, time saving, and also simpler organization. First, I would say that the laser fragmentation is quite different from other flags. That's because the lens is fragmented into tens of thousands of 200 micron cubes. And I think also there's no gas released because the energy was automatically adjusted for 24 zones within the lens, so that adjusts for the energy and that prevents for excessive gas release. And I think this was also designed to facilitate the aspiration, to reduce or even completely eliminate the use of ultrasound in almost all the cases, at least in the vast majority of the case. And I think that's most important, and it's a main objective of an innovation that would change the cataract surgery paradigm, because what we need is to avoid using ultrasound. So if you can no longer use the ultrasound to extract the lens, that's a true innovation. And on this, we know that traditional flags only marginally improve, that is, they still need ultrasound energy. And I think this is explaining their modest adoption. So in this study, the 33 patients had an average grade of 2.6, which is, I think, much higher than the average grade that we see in US clinics, for example. The effective Phaco time measured in the study eye and the control eye, remember there's a femtometric eye and a conventional Phaco eye, were compared, and the results are clear. There is a 88 reduction. That's impressive. It's 30 to 40 times greater in terms of a reduction of the time of effective Phaco time. That's what was usually described in literature on comparable populations. And that predicts, I think, a profound change in the future of the cataract surgical technique. If I remember well, there were 29 out of 33 patients having a 0 Phaco, despite an average grade of about 2.4, which I think is totally unprecedented. Oh, this is where it gets interesting, because very few studies have looked at the correlation between the suction time and the use of Phaco after flags. I think recently Rivera and some collaborators did just that. They compared two surgeons using either catalytics or lensics. And when you compare the 33 cases we've done with the femtometrics to the data from Rivera et al., what you see is that the femtometrics had a very different mode of operation. The correlation, I think, between the aspiration time and the use of the Phaco is much more favorable, and the non-use of the ultrasound does not significantly lengthen the time of the procedure. Well, I think the femtomatrix combines several breakthroughs that can change the way that clinics will organize their operation in the future. The robotic arm, which is made possible by the transmission of the femto laser signal through an optical fiber, I think will definitely alleviate some of the pain points of docking. It will make the procedure more fluid for surgeons, and that will also facilitate the integration of everything in the OR. And this is a potential breakthrough which creates more opportunity than we can even envision today. I would say also that the personalized laser energy and the multi-spot makes it possible to achieve a zero Phaco in the majority of the patients without compromising the surgery time and also the patient workflow. So I think that's good for patients, that will be very attractive to them. This will also be good for surgeons and also good for operating efficiency of the clinic, which is today a very important factor. Well, yes, it is certain. An investment in new technology can only be justified if the benefit is truly significant. And we see that there are, for the first time, a technology which is able to completely change the usual process of cataract surgery by almost completely eliminating the use of ultrasound. I think after 30 years of good and loyal service for the Phaco and US, it seems to me that the time for change has come, and we need to move on and to continue to improve cataract surgery with this remarkable technology and innovation.